Hello guys, welcome to Dr. Science. So today we are going to talk about the anastomosis of scapula. In order to understand this, we have to understand the arterial supply to scapula. So the arterial supply to the scapula is mainly the subclavian artery. So suppose this is a subclavian artery. This subclavian artery will eventually continue as your axillary artery, and eventually the axillary artery will continue as your brachial artery. Now, subclavian artery is not going to is not a branch, or the axillary artery is not a branch of your subclavian artery. It is the continuation of your subclavian artery. So the subclavian artery at the rib number 1 outer border is going to continue as your axillary artery, and similarly the axillary artery is going to continue as brachial artery at the lower border of teres major. Now the subclavian artery is going to give 3 branches. I am going to draw this one here. So imagine this is your subclavian artery. This subclavian artery is going to give 3 branches. We are going to use the mnemonic VIT. VIT. V stands for vertebral artery. I stands for internal thoracic artery, and finally we have the T, which stands for thyrocervical trunk. Again, from the thyrocervical trunk we are going to form mainly 3 branches. We will name these 3 branches as your SIT branches. S stands for suprascapular artery, and I stands for nothing, it's just the mnemonic, and T stands for the transverse scapular artery. Okay, so we first from the subclavian artery, we will have 3 branches. One is your vertebral artery, the other one is your internal thoracic artery, and the third one is your thyrocervical trunk. And from the thyrocervical trunk we are going to have 3 branches. One is the mnemonic is SIT. S stands for suprascapular artery, and the third one is your transverse scapular artery. Now from the subclavian artery eventually we will have the axillary artery. From the axillary artery we are going to have one of the branch, which is your subscapular artery. So we are going to draw the diagram here. Suppose this is the scapula. And here is our subclavian artery. From subclavian artery we are going to have the most important one, which is your thyrocervical trunk. Now the thyrocervical trunk is going to give a branch which will supply the upper part of the scapula. Hence, this branch is known as your suprascapular artery. And from the same thyrocervical trunk, one of the branch will come, and it is going to supply the transverse part of the scapula. Hence, this branch is known as your transverse scapular artery. And not only that, the subclavian artery will eventually continue as the axillary artery. And one of the branches of axillary artery was your axillary artery is let me clear this one. So one of the branches of your axillary artery is your subscapular artery. Now eventually this subscapular artery is going to supply the lower part of the scapula. Hence it is called as your subscapular artery. And the branch of this subscapular artery is your circumflex scapular artery. So as you can see here, at the level of the scapula, there are mainly three arteries which are coming and fusing with each other, and there is a anastomosis here. Now this anastomosis is called as your scapular anastomosis. And what are the three main arteries which are involved in the scapular anastomosis? One was your suprascapular artery, the other was your transverse scapular artery, and the third one is your circumflex scapular artery, which is a branch of your subscapular artery. So scapular anastomosis is going to contain mainly three branches. The first one was your suprascapular artery. The second one is your transverse scapular artery. The third one is your circumflex scapular artery. I hope you are clear with this. Thank you guys.